I hit the record button. So now don't say anything bad about me now because it's being recorded. Okay.
Okay.
Okay, everybody. Well, thanks for joining us this afternoon. We're going to talk about kind of getting down into the depths of the VMSG dashboard today. Operational planning is the core function of the VMSG dashboard. So we're going to dig deep into operational planning today. We are recording this. When we're done, I'll put the recording up on YouTube and send you the link so you'll have it as a refresher or for those folks who haven't had the opportunity to do it today. So let's go ahead and get started. We'll go past the workhorse development. First thing, let's review the planning model here. I know we've talked about it, but I just kind of like to go over it again. So the organization is just your health department, and that tab, when you get to it, is basically just got one entry in it, and that's your health department. Underneath that, we have the groups. Groups are the structure of your health department, plus anything that is a high-level plan, like the ones you see in the bubbles up here, are typically groups within themselves. And there's some other things. It's a little bit undefined in some cases as to what can be groups, but anything you need the highest level of the plan could be a group in itself. Each group has its own set of services or initiatives. Services being the ongoing things that you do. Again, I use the example of WIC as an ongoing service provided by public health. Initiatives are those future programs you're trying to roll into, things that you're trying to create and do with public health. Each of those has a set of high-level goals. Each high-level goal, a set of SMART objectives. Each SMART objective, a set of activities. So what we're going to do today is we're going to go in detail on each level of the pyramid here, and we're going to go through some real live public health examples. So what we did is took plans in public health and extracted all the different groups so you can see different levels of groups, extracted services or initiatives so you can see what they look like. Sometimes it just helps to say, oh, what would constitute a service? And here we are. Now, the nomenclature that we have here is fairly constant, but not cast in concrete. It's been around for a long, long time. This is kind of the de facto model for operational planning. However, some people like to go in and put their own terminology in there at the different levels. So what I've done is gone through and looked at some of those different plans with different terminology. The model still fits, but the terminology changes. So the idea here is to be able to look at different models of the nomenclature and be able to say, oh, I see when somebody hands you this plan and it's got different nomenclature, you can say, yeah, that's actually a group or that's a service or a goal or whatever is there. So let's look at some of those. Here's the first one, strategic priorities at what we call services or initiatives, and then goals, strategies at what we call objectives, and then objectives what we call activities. So you can see they kind of took that around. Now, in my book, strategies are a way to get somewhere. So realistically, the strategy would probably be more like the activity, and then the objective would be moving up. So strategic areas, pretty good definition of the service or initiative. Goals, outcome objectives. I like that term because it's the outcome that we're trying to achieve is the SMART objective, if you will. And then strategies to get to the outcome objectives is pretty good. Priorities, goals, objectives, and action steps. Action steps is probably the most common term we see for activities. Priority areas, goals, strategies, again, kind of in the wrong place, I think, and action steps. Priorities, goals, objectives, and strategies, pretty good. Strategies, strategic objectives for goals. I kind of like that one. I think it's a higher level than an objective, so it kind of makes sense in there. And then objectives and action steps. So again, the reason I go over this is if somebody comes up to you and says, here's our new chip, and it was developed by a consultant or something, and they have their own nomenclature, you can look at it and say, okay, this is really a service or an initiative, even though they call it a strategic area, that sort of thing in here. Now, let's go down and go through each level of the pyramid here. So groups. Let's go take a look at your group screen to start with here. So I've got your account pulled up here. I'm going to go to the group screen. Groups typically always start with the department as the highest level group in here. A lot of times there's nothing under the department itself. You start breaking it down for there. Sometimes there are specific plans, at the high level of the department. And then you see what we have down here is the Fab 6-pack of plans down here. They're level 2s. So the groups are leveled 1 through 10. I don't think anybody's ever gotten past 5 or 6 to the best of my knowledge here. Then you'll have a group down here called accounting, and then clinical, community outreach, that sort of thing. And it looks like most of your groups are level 2 groups, so they're probably all reporting up to the department. In some cases you'll have a group of things that report to one another. So maybe you'd have something under accounting like grants or something along that line. So again, groups are hierarchical, and it's the structure of your department. So let's take a look. So the department, again, is typically the level 1 group of pretty much every department. And let's say we had a group called community health. It's a level 2 group reporting to the department. And in this particular little department we've created here, we have WIC as a group reporting to community health, which is reporting to the department. So we have WIC as a level 3, reporting community health as a level 2, and department as a level 1. And then you'll see the highest level plans, like your strategic plan, the Fab 6-pack of plans, they call them, are typically level 2s reporting to the department. In some cases, we put those down at another level. So there's an accreditation group that's level 2 reporting to the department. Then under the accreditation group, you might have the accreditation plan, the strategic plan, a CHIP, et cetera. But you can move those around. And by the way, it's very, very simple to move them around. And if you move the groups around, you're not affecting anything downstream in the pyramid here. It's kind of a way that you want them organized. Your CHIP is the same way. It's typically level 2 reporting to the department. And then today we're going to use the same example we did in the overview for Tobacco 2024 as our group, and we're going to work on the tobacco cessation plan. So that's kind of what the group screen would look like. Again, it's a hierarchical view of your department primarily. And then we have services or initiatives. Again, services are those ongoing things. Initiatives are future programs. So I'm just going to go over, again, just a bunch of examples that we've extracted from public health plans. Now think about these as a bucket or a container for plans that'll get you to there. So we want to have plans that will get us to healthy moms and babies, or to be ready for emerging health threats, effective agency processes, access to care, behavioral health and substance abuse, population health, organizational excellence, chronic disease and prevention control, health disparities, and again, for today, we'll use the example of tobacco cessation. So if you look at these aren't really actions. They're really not plans. They're just more of a container for a plan that'll get us to this outcome, if you will. Now, underneath services or initiatives, we have goals. Goals are typically fairly simple, fairly high level. A lot of times it's going to be an action verb followed by a few words. So the example, reduce the risk of infectious disease, promote safe and sanitary food establishments, support communities in building resiliency, enhance healthcare through technology, drive health in all policy agendas, reduce the risk of vaccine preventable diseases, promote public health readiness and response, promote succession planning and career growth, integrate a data-driven best practices approach. And again, we'll use the example of reduce smoking in high schools. Now, at this level, again, it's fairly simplistic. When I say reduce smoking in high schools, everybody understands what that means. What it doesn't tell you at this level is which high schools are we going to start with? How much do we think we can reduce smoking? By when can we do this? So that's where we get down to what we call SMART objectives. And again, you go Google SMART objectives, you'll get probably 100 different definitions in here. Ours is pretty simple: specific, measurable, attainable, realistic or relevant, kind of take your choice there, and time-based. Now we typically focus because, if it's not attainable or if it's not realistic, why waste your time? So we typically focus on specific, measurable, and time-based. So as I show you these examples of objectives, kind of look for those three things in there. Look at the first one. By December 2024, identify 2 or more strategies to collaboratively reduce risky alcohol-related behaviors. So the specific part is the strategies to collaboratively reduce risky alcohol-related behaviors. The measurement is 2 or more, and our timeline is by December 2024, so it fits pretty well. Look for that in each of these. By December 2024, 80% of educators and school staff have been exposed to ACE awareness education. By June of 2024, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, All programs will have established goals, objectives, and activities to be reported on within the VMSG dashboard. And then we're going to go back to reduce smoking at lovely Wayne High School by 25% by the end of the school year. So when I tell you that, it's a nice target. It's exactly what it is. It's a target. This is what we're trying to accomplish. What it doesn't tell you by any means is how we're going to get there. So we've established the target. Now we have to define how we're going to get there. And that's going to be through the activities. Now I'm going to go through the 3 types of activities and 3 different examples, but I'm not going to go into great detail right now because we're actually going to go and enter this smoking cessation plan in the system and go through all the different possibilities of all the different types of objectives and activities and everything while we do it here. So let's talk about project-based activities. So this was, by the way, the original only type of activity when we first developed the system about 15 years ago. Project-based activity is the most common, the most used. So here's an example. Create training content and materials for students and faculty on the dangers of smoking. So creating training content would be PowerPoints and user guides and maybe some video stuff and whatever you need to do the training. So it's a project. Now, there's always a performance measure with each type of activity. The project-based activity is the only one where you manually come up with a performance measure. So the performance measure says, how do I know when I've successfully completed the activity? And when you're doing that, maybe you think about if somebody else was reading this activity, how would they determine that we have completed the activity? So in this case, it's real simple. We're creating training content. Once we finish creating the training content, boom, we're done. We're going to set a date range. This is our initial date range. So we're going to say April 1 through May 31st. Now, over time, real life happens. People have to do real work and things slip. So you can move those dates out to make it realistic with what you're tracking in here. We're going to do team assignments. So we're going to assign internal team members and team lead. And then potentially we're going to do external partner assignments in here. And then we're going to have a measurement. The measurement is real simple. It's percent complete. How far along are we in creating the training content? And again, when I go into actually entering this plan in the system, we'll go into a lot more detail on these. Our second type of activity we call a quality assurance activity. Here's our example. Provide 9 training sessions each month on the dangers of smoking to students and faculty. So the uniqueness about the QA activity is that it's repetitive. So you're saying 9 sessions each month. So you're going to set a frequency, and I'll show you how we do that in a minute here. The frequency can be anywhere between weekly and every 5 years. So it's a repeating process or a cyclical process here. And the other thing we do on this one, because we know that we're in a monthly cycle, we know that we're going to provide 9 training sessions in that month, we're actually going to set the traffic light automatically based on those values here. So we're going to say if we meet our target of 9 or greater, then it's going to be green. And then we're just going to pick a red value here, and we're just whatever you think is not acceptable here. So if we only do 6 in a month, we're going to say that's red. And then obviously the system can calculate 7 or 8 to be yellow in there for you. So automatically sets the traffic light and is repetitive on a basis that you choose called a frequency. Instead of a beginning and ending date, you have a beginning date and the frequency. So if it's May 1 is the beginning date and it's a monthly frequency, then the end of May will automatically be the ending date. Then you move into June 1 and then the end of June will be the ending date. So there's always an ending date. In this case, it's calculated versus entered. Our performance measure is calculated for you in this particular case. So it's going to be training sessions provided, measured monthly, and then our green, yellow, and red values in here. And we're going to do team and partner assignments again. And as you can imagine, our metric is real simple. How many training sessions did we provide? So that's the QA activity. Again, I'll go into more detail in a few minutes here. And then the third type of activity is called a quantitative measurement activity. Very, very similar to the project-based activity with the one exception that we have a target quantity. In this case, we're going to contact all 20 tobacco vendors within a mile away in high school. So the target quantity is 20. What that allows us to do very simply is say we did 10 out of 20. It says we're 50% done. We're going to have beginning and ending dates just like we did in the project-based activity. The performance measure will, again, be created for you in this particular case. So it's going to say we have a target quantity of 20 tobacco vendors to be contacted between May 1 and June 30th. That's how we'll know we've succeeded in completing the activity here. Again, we're going to do team and partner assignments. And as you can imagine, our metric is real simple. how many tobacco vendors did we contact. So those are the three types of activities. Now, at the bottom of each screen, and in some cases, like here in the screen itself, we had a blue line in here that is the plan that we've been talking about, tobacco cessation. So I just want to kind of show you the plan in a bullet form here. So the group was tobacco programs for 2024. The service or initiative, in this case, the initiative was tobacco cessation. The high-level goal was to reduce smoking in high schools. The SMART objective was to reduce smoking at Wayne High School by 25% by the end of the school year. And then we have the steps we're going to go through to get there. Activity 1, create the training content, provide training sessions, contact the tobacco vendors. Now, this is just a segment of a plan. Plans can repeat at any level. You can have subgroups, so you can have multiple levels of a plan at the group level if you wanted to. Not real often that happens. Typically, the repetition starts at the service initiative level. I think you saw that in the system that we had multiple initiatives in there. You can repeat it at the goal level. So in this case, we have reduce smoking in high schools. The next goal might be reduce smoking in colleges. And then underneath that, we're going to build a similar plan. So our objective in this case will be reduce smoking at good old Wright State University by 25% by the end of the school year. And then we're probably going to have a similar set of activities that'll get us there. So this is the operational plan for tobacco cessation. Now I'm going to show you the plan in a template. This operational plan template was actually initially created by one of our health departments in Wisconsin. The reason is they wanted to be able to get it out on paper, kind of put it in front of you and, pass it around to their peers, make sure everybody agrees with it before they enter it in the system. And they were new to the system at that point. You can, either go either way. You can do it this way or any other way. You can build yourself a chart like we did before with the bullet points on it, or you can just go enter it directly in the system. And if you enter it directly in the system, it's pretty easy to move things around and adjust things. So it's really kind of either way. But one of the nice things that will happen today is I'm going to use this to enter this plan into the system. And one of the really nice things is you don't have to sit and watch me type for the next half hour. So I'm going to copy and paste it into the system. So first thing I'm going to do is go back to the original. This is the original template. And by the way, attached to the meeting invitation is a blank copy of this template. It has everything in here except the actual like tobacco cessation and such in here. So what I'm going to do, I'm going to go back to here. We put in this little group down here called training. And then under training, we have a subgroup called Tobacco 2024. So under Tobacco 2024 group, I'm going to go to services or initiatives, and you'll see it's blank. In order to add anything, you either have to hit the plus button, because right now you do not have a record open for this particular service or initiative. So I can either hit the plus button or this really, really big plus button down here. What this does is block you from putting anything in until you create the record here. So I'm going to go ahead and open that up. Now I'm going to go back to our template here. I'm going to grab tobacco cessation and I'm going to copy it. So you can right click and copy if you want to. I use Control C to copy. Go back over to here and just hit Control V as in Victor is paste. So I'll paste that in there. I'm going to call this an initiative or a future program, and that's just this checkbox right here. Doesn't have a lot to do with the plan itself. The plan is pretty much the same. However, when you get down to reporting and some of the things down at the activity level, future dates and nomenclature is different here. So I'm going to call this an initiative. So we identify it as something in the future here. I'll save that. So now we have the tobacco cessation initiative you can see up here. Just kind of an FYI. If let's say this is the plan tobacco cessation for 2023. I want to keep it available so people can look at it, get reports on it, whatever they want to do. But I just want to take it out of everybody's primary view. That's what this hide service down here at the bottom right is for. So if I click on that and then save it, you'll notice it grays out up there. What that means is anybody who's a normal user won't even see it. So they can't get to it. They can't change it, can't do anything. If you are a manager level user or an org admin level user, you'll have access to it. You can go in there and do reports on it, look at whatever you want to do. It's there, so you've got a reference for historical information in there. I'll go ahead and uncheck that, save it. So down here, by the way, anything at the bottom of any of these screens is happening on your local computer. What moves it to the server for the multi-user is hitting the save button. So in this particular case, I've got tobacco cessation. Anything I change down here, it won't change at the server until I hit the save button. just kind of an FYI. And by the way, the reason for that is it's a very efficient way to do multi-user computing, because now you can literally have 6,400 users on the system here. So everybody can be working locally, and it just takes a fraction of a millisecond to shove it up into the server. So, okay, so we have tobacco cessation as our initiative. Let's go back here and grab our first goal, reduce smoking in high schools. Again, Control C, go back over to here. Now, because I've selected tobacco cessation, when I go down to the next tab, the goals tab, it's going to be the goal specifically for tobacco cessation. So I'm going to again open it up here. I'm going to hit Control V to paste it into here, reduce smoking in high schools. I'll go ahead and save that. Now at this point in time, we have the traffic light. Traffic light is just exactly as you'd expect it. I mean, if you've driven before, you know what traffic lights are, right? Green means things are moving along as expected. Now, since this is an initiative or a future program, and we haven't really started the program yet, it's probably going to be green. There's no reason for it to be behind schedule because we haven't even started yet. So probably going to be green. Yellow would be something has happened to move this behind schedule. So maybe once we're into it and somebody's going to retire from the organization who's going to run the program, and we haven't got somebody new, we might mark it as yellow, put a note over here that, hey, Fred is retiring from the health department and we need to find somebody else to run this program. Red would be Fred walked out the door, don't have anybody to run the program. And then the gold bar would mean that we have successfully completed this portion of the plan, which means we've completed the goal, the objectives, and the activities. Now, not every plan element will get to successful completion. Reduce smoking in high schools. Wouldn't it be great if we got to 0 across the whole nation? Yeah, that'd be really cool, but probably not going to happen. So probably going to stay at green as we're moving along here. So go ahead and save that again. Okay, so that is our goal, to reduce smoking in high schools. Let's see if we have some other goals down here. I believe they talked about reduce smoking in colleges. Control C, let's go over here. Now to add that next goal, I'm gonna hit the plus button down here in the bottom right. Opens up the bottom for us here, adds the new record, reduce smoking in colleges. I'll go ahead and save that. And we'll go back and there's a third one, I believe, reduce smoking in public areas. Control C, go back to here. Again, hit the plus button, opens it up, Control V, save it. Okay, so now we have our 3 goals in here. To get to the objectives for reduce smoking in high schools, I got 2 choices. That is either to click on reduce smoking in high schools and then hit the objectives tab, or we have what we call drill down arrows. Now, when you get a whole bunch of different planning elements on a screen here, sometimes it's easier just to go up and click on the drill down. What that does is select reduce smoking in high schools and takes me to the objectives tab. So it just saves you a mouse click. So I got the objectives tab here. I'm going to go ahead and open that up. Go back over here. Scroll back up to the top here. So our first objective, reduce smoking at Wayne High School. Let's grab that. Control C, go back over here. Control V. I'll go ahead and save that. And you can just continue to save it as you need to. If you save something that's hasn't or has already been saved and it'd be a duplicate, it'll warn you that, hey, you're creating a duplicate history record. We'll talk about history records in the next training. Okay, the next thing we're going to want to do when we're putting in an objective is setting what is our target down here, or how are we measuring it. So our target is to reduce smoking at Wayne High School by 25% by the end of the school year. The default for an objective is objective percent done, basically 0 to 100%. In this case, what we're measuring is percent reduction. So if I click on this title where it says objective percent done, opens up this little window for me here. And I'm going to say percent reduction. Our measurement units is what appears after the little field down here, and it's percent. So we're going to leave it as percent. But we have choices here. We can either continue with measuring percent, or we can measure decimal. Decimal is widgets, whatever you're counting. So if you got something in here that you're counting, vaccinations or medications or whatever it is, you can use decimal. In this case, we're going to continue with percent. So I'll click on that. So now you notice that the title changed to percent reduction. Our current value says 0. Let's go ahead and say we're at a 20% reduction right now. Now I'm going to go ahead and save that. Now, anytime I save a goal, objective, or activity with the traffic light, and I've made a change in there, especially down in this field down here, it's going to say, is the traffic light set correctly based on your update? In this particular case, you could say, yeah, we're moving along, we're getting to 20, or you could say, no, we're only at 20% out of 25. I might want to mark it as yellow. So I'm going to go down here and say, let's go ahead and set the light to yellow. And when I do that, I'm going to put a note down here. So I got a couple of choices. I can either say, this is a test note, or I can hit this little button right here, which puts the date, the time, and the person. System admin would be it would say Fred Erickson if I was logged in that way. Um, so I said only a 20% reduction, set the light to yellow. And I go ahead and save that. So now what I'm doing is, because I changed the light, I'm putting a note and I'm putting my date and timestamp so everybody will know who did what when. So it's just a nice way to track things, because you're not necessarily the only person who's going to be doing that. Now, over here, we have the objective lead. So who's going to be actually managing this program at Wayne High School? So I'm going to hit the drop down here. The reason it's empty is because we're in a training group which has nobody assigned to it. So I'm going to go ahead and say select all users. I'm going to show all users. I'm going to go ahead and just pick Jim up here at the top and save that. So we have Jim Compton as our objective lead. And I'll save that. And you'll notice he appears up here on the top right. So Jim is up there. Jim's got two jobs. He's the program manager for reducing smoking at Wayne High School to get us to 25%. And he's the guy who's going to do the updates on this, typically using the real-time planning email notification. Pardon me. Okay, so we have the objective. Now, the data source field down here, this is available at the goal, objective, and activity level. You may have noticed it on the goal screen as well. But if I have a place that I can go to get this information, so I can enter it every time, so it's always going to be updated, it's nice to have at your fingertips. So let's say we can go to the CDC Smoking Cessation Fast Facts webpage and get this information. So I'm going to click on the source field here, which is the button, if you will. And I'm going to say CDC now, when you put in the link, you got to start out. This, by the way, this link could be on your intranet, it could be in your file servers, it can be internet, it can kind of be anywhere. But you do have to designate what type of link it is. So I'm going to say HTTP, could be HTTPS for secure, ://. And I don't have the entire link for the smoking cessation, so I'm just going to put the CDC website in there. So www.cdc.gov, and then I'm going to save it. Now, I'll go ahead and save this again. Now, the data source you can see is the CDC Smoking Cessation Fast Facts webpage in here, and this little link appears. This is the link that you click to go there in a new browser tab. So I'll click on that, and it should take me to cdc.gov. Yeah, because I don't have the whole link in there. So anyhow, we're at the CDC webpage. So the idea here is, if you've got a place to go, whether it's, again, intranet, internet, files, whatever it is, got a place to get that information, let's have it at your fingertips. So that's what the data source is all about in here. So that kind of completes the objective. Again, the objective is the target. This is what we're trying to accomplish. Now, to get there, we're going to have a set of activities here. Let's go back over to here, and we have 3 activities. We got one of each type: project-based, QA, and QM. So I'm going to put those in there. I'm going to go into some detail on the different variations here. Control C, let's go down to here. So my first activity I'm going to add is paste it in there, create the training content materials. It is a project-based activity, so I'm just going to leave it at that. I have to put in a performance metric. If you recall, the project-based activity is the only one where you manually create the performance metric. So I'm going to go back and grab that out of here. Training content materials created, Control C, back over here, Control V. Now I'm going to go ahead and put in a date range. So let's go ahead and just say it's November 1 through November 30th. And I'll go ahead and save that. So now what I've done is created the activity to create the training content. I've got the performance metric in here. It says, how do we know when we created the training content? I got when we're planning on doing it in here. So that's our first activity. Now, the measurement for this particular activity is going to be % complete. So down here, I can put in, let's say I put in a note that says chapter 1 of 4. To me, that's 25% of the way there. So I'll put in 25% and I'll go ahead and save that. Now, again, because I changed this value, it's saying, is the traffic light okay? Well, I'm in the process of creating the training content. I'm not behind schedule. I'm just moving through the process. So I'm going to say green light is okay. I'll leave it at that. And then if I were to go in here and say completed chapter 2, I'd probably move that to 50%, et cetera, as we moved up the chart here. Okay, the next thing we're going to do is assign a team of people to do this, to actually create the training content. This little pencil icon opens up the activity leader and team members. And again, there's nobody assigned to this Tobacco 2024 group. So in order to remove that group filter, I just hit any one of the 3 little black X's up here. So I hit the black X, and now you see we've got everybody on there. So I'm going to first of all pick Kim as our lead. Now, when I click the lead, it automatically makes her a team member and by default gives her the email notification. And then we'll go ahead and pick Erica and Tammy as team members. So you can see now we have the 3 team members. We have the team lead, Kim, and we have Kim getting the email notification. I'll go ahead and save that. Now you notice down here the L is lead. The blue around the L is email notification. And then the T is team members. Now, I don't know if you guys have any partners entered in the system or not, but the next thing we would do is if we had an external partner involved in this, click on that, and you guys don't have any in there yet. So on the left side would be partner organizations. You may recall in the training we had VMSG dashboard in there. And then when I click on the organization, I can have 1 or more contacts in here for that organization. You don't have to have them, but you could have. So we had Fred Erickson at VMSG dashboard as our partner. So I can select them. And now what we've done is basically attach them. It's more of a reference to the partner. Now you could make that partner what we call a partner user. So they have to have a license, and then you can assign them to the email notification and to the team and that sort of thing. But in this case, we're just going to call them an external partner here. Now, project-based activity has got a little wizard. All of them have this little wizard right here. So the little wizard button, when I click on that, this one is fairly simple. Got a beginning and ending date, so I can enter it here or down here. Either one's the same. Data entry type. The default is 0 to 100%, as you can see over here. But let's say I'm going to go and create this training content this week, and Friday I just want to go in and say I'm done. I can have a complete checkbox here. So when I click that, you notice the complete checkbox shows up down here. So it just makes it simpler. Now, back into the system itself, unchecked is 0%, checked is 100%. So you only got those 2 choices. So if I check this, something else you'll notice on a project-based activity, if I get to 100%, the traffic light turns to gold. I'm going to go ahead and save that. And you'll see the light up here will turn to gold as well. The other option I had was yes, no. So if I have an activity that's worded as a question, so have you completed the training content, whatever that might happen to be, got the same thing over here, yes, no. Unchecked is no, 0%. Checked is yes, 100% in there. So I'm going to go ahead and move it back to 0 to 100%. You can see it's set there for 100%. Go ahead and save that. So that is our first activity. Now let's go grab the second activity, which is that quality assurance activity. Provide the 9 training sessions. Control C. Okay, so I'm going to hit the plus button to add a new activity. Control V. Provide the 9 training sessions. We're going to call that a quality assurance activity. And you'll notice when I click on this, it opens a wizard here. So here's that frequency I was talking about, the repetitive. Anywhere from weekly to every 5 years. So you can see we got quarterly, monthly, biannually, bi-monthly, annually, whatever you want. I'm going to go ahead and call this monthly because we're doing 9 training sessions each month. And in here is we're going to say, what am I going to use to set the traffic lights? So we know that our target is 9. So I'm going to put 9 in here as my green target. We pick any number 1. I'm just going to say 6 is our red target. And then you'll notice it calculates the yellow to be 7 or 8. Our metric type in here is training sessions provided. And when I save that, you'll notice it creates the performance metric. Training sessions provided, measured monthly, and our green, yellow, and red values in there. I go ahead and save that. Now you'll notice that the traffic light is red, and that's because of the auto set here. We're sitting at empty is 0. So if I say, let's say we go to 8. So we've taken that to 8. When I click off, you notice the light here turns yellow. When I save it, it'll move up Now, after the first time you enter a QA activity, it's going to ask you, are you done with this period, in this case, this month? Do you want to move the cycle start date ahead? You can say no, and it's going to leave it at 11/1. You can say current, which would put it on what is 11/12 or whatever it happens to be today. Or I can say select. If I say select, it's going to by default give me the first date of the next month because it's on a monthly cycle. I'll go ahead and say okay, and you'll notice the start date moves ahead here. So it automatically moves it ahead for you based on the frequency that you've selected in there. Now, in this particular type of activity, there is another option in here called timeline. I'm going to, when we get done with entering this plan, I'm going to go ahead and enter a timeline activity just to show you what it's all about, but it's pretty cool. One other kind of an option in here that you'll see is right now the green is greater than or equal to. Well, there's some things that less than is better, right? So I use the example of a golf score. Less than is better. I can click on this little greater than or equal to and flip it around. It becomes less than or equal to. The two fields become 0 because you got to have them in the right order. And then I can say this is less than or equal to 3 is green and greater than or equal to 6 is red. And then that would make it 4 and 5 would be yellow in there. So you can do it that way as well. So it just gives you the ability to have both of them. And it's just clicking on this little guy. So I'll do that again. And we're going to say 9 and 6 and save that again. And then save it up here. And we'll just say, no, we're not going to select a date. Down here, you would go through the activity team lead and team members and external partners again, but we won't go through that. It's the same thing. So that's our second activity. Our third activity then is the quantitative measurement to contact all 20 tobacco vendors. Control C, go back over here, hit the plus button, Control V. So we're going to call this a quantitative measurement activity. And again, it opens a wizard for us. Let's go ahead and just call it 11/1 through 11/30 again here. And by the way, you can type in these numbers as well if you want to. Calendar is just a little drop down if you like it. We know our target number is 20, so we'll put that in there. Decimal or dollars. This is the type of activity if you're managing grants, budgets, anything else, you can use the dollar thing. And that's basically all it is dollar sign, a couple decimal points. Decimal is counting anything else. So any widgets or car seats, or in this case, tobacco vendors. So my metric type is going to be, if I could type, tobacco vendors contacted. Now there's a couple of choices down here as well. Enter a value to add to total. So it's going to keep summarizing here. I'm going to go ahead and leave that in there for now. So our performance metric says 20 tobacco vendors contacted between 11/1 and 11/30. And you'll notice over here, let's go ahead and save that. Notice over here we have this add to. So let's say I'm doing this contacting over the course of a month, and I'm going to go out every week. So maybe the first week I go in and put in, I did 5 vendors. You notice it rolls up to the actual 5, calculates that against the 20 target, and says it's 25% done. So I can go ahead and save that. Is the traffic light? Yeah, it's fine. We're doing good. Okay, and then the next week, maybe I go in there and put in, and we did another 5. It rolls it up to 10 and calculates me 50% done. Let's say okay. So that's what that one's all about. Now let's go look at the other option down there. The other option is enter a new total value. So when I do that, the summary field goes away. It rolls up the current value to the actual field here. It's still calculating 50% done, but this is, again, the same thing I was talking about. I'm going to go contact all 20 this week. At the end of the week, I just want to go in and say, I've done 20 tobacco vendors in there. And I'll go ahead and save that. Now, there is another option in here I wanted to show you. And I'm going to go ahead and set this back to a value to add to total. It's what we call a zero target. One of our health departments in Ohio was doing plumbing inspections, or they were counting plumbing inspections. And they don't have a target number. They just want to know at the end of the month, how many did they do? So what you do, we call it a zero target. You put in 0 in here and we save it. And what you'll notice is the percent calculation went away. The reason for that's pretty obvious. The target number is your denominator. If it's 0, you can't divide by 0. So hence what this is doing, just, giving me the total. So maybe I contacted 5 of those plumbing, or saw 5 of those plumbing inspections. It rolls up to 25. At the end of the month, I can just go in there and say, hey, we did 25. Didn't have a target number to do it with here. So that's what that's all about. Go ahead and make this back to 20 and leave it there. Okay. So you notice it also calculated to be 125% down here. So that's the 3 activities and kind of all the different variations of the activities down here. Again, you got the data source you can add down here. You've got the partners and the activity leaders and everything else. So I want to go and kind of walk through that plan in the pyramid here. Oops. Let's get to the right place here. Okay, so the organization groups. So the group was Tobacco 2024. The initiative was tobacco cessation. The goal was to reduce smoking in high schools. The objective was reducing smoking at Wayne High School by 25% by the end of the school year, and then the 3 activities that we had to do that. So that is the operational planning model, and that is the operational plan. Now, I told you I wanted to show you one additional type of activity, and I'm going to forewarn you that it has absolutely nothing to do with this plan, but I do want to show it to you. It's something new that we added based on some feedback from one of our Michigan departments, and so we call it timeline activity. The timeline activity is all about managing critical documents. So let's go ahead and I'm going to add this activity. I'm going to hit plus in here. I'm going to say manage standard operating procedure, SOP 1, say update, SOP 1, and update SOP 1 annually. So what I'm doing is standard operating procedure document number 1 is going to be updated annually here. So now I'm going to go down and select the QA activity. We know that it's annual, so I'm going to select annual. Typically, it's going to be on a fiscal year basis. It doesn't have to be, but let's go ahead and set that back to July 1st. I'm assuming that's your fiscal year, may not be. And then we got this timeline checkbox down here. When I click on that, the other fields go away. We just have a percent to yellow. So what I'm saying is I'm going to get notified every year to update this particular standard operating procedure. The percent to yellow says when during the year do I get notified. I'm going to say 90% of the way through the year. And then I'm going to say update SOP. Okay, now when I go ahead and save this, you'll see the metric update SOP measured annually, green, yellow, and red. I'll go ahead and save that. Now, the next thing you're going to want to do is actually attach that SOP, the standard operating procedure document. This is document management. You'll see it on every screen. It's real simple. Click on this button. Then the same thing. I can hit the plus button, or I can add, in this case, plus button's down here. I can say, okay, let's go ahead and add a document. It's going to tell you to choose a file. It can be on your network, your computer, anywhere you want it to be. I'm going to go ahead and choose that file. I've got a bunch of test documents up here that, where's my test? There we go. I'm going to say it's the 24/7 coverage. So I got the file and I'm going to upload it. You'll notice the file name appears down here. It says how big it is and the date and everything. Then I'm going to describe the file. I'm just going to call this SOP1. I can change the traffic light. Let's say it's green for now. I can put notes in here. I can put time and date stamp on the notes. Pretty much everything I could do, and I'll save it. Now I have the SOP attached to the activity. So here it is right here. You see the 1 is attached. So here's what's going to happen. Well, let's see. Let's go ahead and assign a team lead to it here. Let's go down and pick Laura. So Laura is our team lead. Go ahead and save that again. No, we'll leave it as is. Okay, so what's going to happen with this particular activity is 90% of the way through the fiscal year, which puts you, I think, in May, mid-May sometime, the light is going to turn yellow. Remember, it said percent to yellow. 90% of the way through the year, the light is going to turn yellow. When the light turns yellow, then Laura is going to get that automated email notification. They come out on a specific timeline, but let's say it's at the end of the month. She'll get that email notification. She'll have a link that'll take her back to this particular activity. And she'll see that it's yellow, it's due to be updated. She go to here and download that particular document from the document management. She can do the update on the SOP, whatever it needs to be done to bring it up to date. Upload the new document. It'll do automatic version control. So you've got the new document in there. When you save a QA activity, as you recall, it gives you the option to move the date ahead. You go ahead and say select. It'll go to the next fiscal year. So it'll be July 1 of 2025. You'll save it. The lights all turn back to green. Everything starts all over again. So this is just a really, really cool way to manage documents. Let me kind of show you what that looks like. I'm going to go to the USA Public Health org here and show you kind of an example of that. So we have a group called Critical Documents. As I go down here, we have policies as one of the services, standard operating procedures, memos of understanding, grant documents. As I go down under policies, it says manage and update the departmental administrative policies, manage department healthcare policies. Let's go to administrative policies. Update department administrative policies each fiscal year. And then underneath that, I have that activity. I have the document attached down here. So that's an example of how you can manage critical documents. The cool thing about it is it's automated in the background. It'll automatically notify people when you want them to be notified. Now, if in this particular case, if Andrea doesn't go in here and update this, by the end of the fiscal year, the light will turn red and everybody will get notified that the document is out of date in there. The other thing you can do, because of the permissions that you can assign to groups by person, you can assign everybody in the department read access to critical documents, meaning that they can go in there and use the documents for what they're meant to be for. Here's a standard operating procedure that I need to be able to use to do whatever I'm doing in there. So they can do it. The people who are updating it get read-write access to this group so that they can actually go in and update it when they're notified by doing that. So I just wanted to kind of show you that. Okay, so that's what we had to go over today. Now, this is the only training course where we actually have homework. The homework is to go in and create a simple little operational plan. Typically, it's got maybe 6 planning elements. So here's what I'd like you to think about doing here. Go down here to the training. Oops, let me go back to your org here. Okay, so down here towards the bottom is this training group. Go into the training group here, go to services or initiatives, add some kind of a service like have a birthday party for Billy. My son's Billy. Okay, so I'm going to have a birthday party would be my service or initiative. And then after I get that in there, I'm going to go down and have a group or a goal. And the goal would be to have the best birthday party Billy's ever had. So I'm going to put that in there as my goal, save it. Underneath that, I'm going to have some objectives. One of them might be choose a venue for Billy's birthday party by the end of November. So that might be my SMART objective. I might have another SMART objective is to invite all of Billy's friends by mid-December, something along that line. Underneath the look at the venue, I might have a couple of activities like every week go out and talk to a new neighbor about venues that they've used, something like that. Or go to Yelp and find a suitable venue, or talk to folks that I know to find out what venues are good, something like that. So by that time, you're down to that's all we're kind of looking for, some kind of a plan. It can be related to your health department. It can be fun, whatever you want to do with it, but something like I just talked about. What I would ask you to do as you're entering your service or initiative, at the end of it, put in parentheses your initials. That way we'll know who did it. In our next training session, we're going to go through and review everybody's plan. Let me give you kind of a heads up. The place that most people have trouble with is in the SMART objectives. So remember, it's got to be something very specific. You got to have a way to measure it and a time base. So again, by the end of November, pick a venue, something along that line. Or I'm going to, by the end of November, invite 20 Billy's friends for the party, something along that line. So think about that as you're doing it. If you can think of a way to use the 3 different types of activities, so a project-based activity, a QA activity, and a QM activity, that would be awesome. But typically we see about 6 planning elements. And in the next section, what we'll do is actually go through and review everybody's plan and critique them a little bit or say, hey, this is a perfect plan, whatever it is. So that was your training for today. Any questions, anything else I can show you?
Fred, I do have just a quick question.
Yes, ma'am.
If you have I'm just trying to think of like what would be the best way to structure the activity, but if you have something where you're measuring it monthly, but the number, like the target per month changes. So for example, like say your target is to, complete 4 reviews in the month of March and then complete maybe 7 reviews in the month of April. Does it make more sense to do an individual activity for each month since it's not going to be the same target each month?
Yeah, you could do two things. You could use a QM activity and then update it every month, with the new number, or create multiple activities if you know what the future are going to be. You could do that. Or you can use the QA activity, and as you're updating at the end of the month, you assign the new values in there. Either way will work just fine.
Okay, thank you.
Uh-huh. What else? Okay, I don't know if we've scheduled the follow-on training yet or not, but Kayla, maybe typically we like to give you about a week so everybody has time to get their plans built in the system here, and then we're going to go through. And by the way, once we complete the next training and everybody enters a plan, we're going to send you out this beautiful certificate that you can put on your wall saying you're an operational planning expert. So
Awesome. I think I do have our next training. My calendar says next Tuesday at 2 o'clock.
And let me look, and you're probably exactly right. Let me take a look here and just make sure I've got it.
I guess 2 o'clock Central Time.
Tuesday, yes, you are exactly right. 1 o'clock our time, 2 o'clock your time.
Awesome.
Okay, so we will plan on going over everybody's plans. Please take 5 minutes to create a plan. It really is simple, but it's really good to get your fingers in there and actually create the plan, push all the buttons, do all the settings, because that's kind of how a lot of people learn and listen. So please do. Okay, everybody. Well, thank you so much for your time today. Again, you got my contact or Andrea's contact information. If you need anybody, please feel free to reach out to us.
Thank you.
Have a great day.
Thanks, you too.